Hair loss is one of the most common reasons adults eventually look into surgical options after trying other treatments. A hair transplant moves healthy follicles from the back and sides of the scalp to areas where hair has thinned. The procedure is mostly used for pattern hair loss, but also for beard, eyebrows, and scars from injury or surgery. Good candidates have stable hair loss, enough donor density, and realistic expectations about what surgery can achieve. Surgeons often discuss medications like minoxidil or finasteride alongside surgery because protecting remaining native hair matters too. In follicular unit extraction, a tiny punch removes individual follicle groups, which the surgeon then places into prepared channels. In direct hair implantation, a specialized pen loads each follicle and places it directly into the scalp in one motion. Surgery is done under local anesthesia. Patients are awake, the scalp is numb, and sessions can last several hours. The first week brings tightness, mild swelling, and small scabs around each graft, which fall off within about 2 weeks. Between 2 and 8 weeks, transplanted hairs shed. This is called shock loss, and it is expected, not a failure. New growth usually starts around 3 to 4 months. Most of the final result is visible by 9 to 12 months. Risks include infection, folliculitis, poor graft survival, and visible scarring. Choosing an experienced surgeon lowers these risks. Because pattern hair loss is ongoing, surgeons often discuss long-term medication to protect the surrounding native hair. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.